Hey everybody, this is Chris Franchina with Policy Engineer Insurance Solutions. I'm one of the co-founders here, and you are watching our Medicare 101. This is understanding your plan options for 2024. So Medicare can be a complex system. At any point, if you need to stop and take notes, feel free to hit pause. All right, so now let's start with the very basics of Medicare. Let's start with who is eligible for Medicare. Well, if you're 65 or older, you're eligible for Medicare, but you can also get Medicare early if you have a disability and you've been receiving Social Security disability insurance for more than 24 months, that's 2 years, you're eligible for Medicare. And if you have an illness such as end-stage renal disease or ALS, you're eligible for Medicare. And lastly, you need to be a U.S. citizen and a permanent resident for 5 consecutive years to be eligible for Medicare. So this next page we're going to cover is very important. If you are 64 and you're turning 65 soon, you want to take some notes here. We're going to talk about your entry into the Medicare system right now. If you have Social Security when you turn 65, you do not need to sign up for Medicare. You will automatically be enrolled into Original Medicare, Parts A and B when you become eligible. Because you must pay a premium for your Part B coverage, you can turn it down. However, if you decide to sign up for Part B later, your coverage can be delayed and you may have to pay a late enrollment penalty for as long as you have Part B coverage. Now, residents of Puerto Rico and foreign countries will not automatically receive Part B. They must elect this benefit. And again, the source is ssa.gov. That's the Social Security website. All right, now the second portion we're going to cover, this is your entry into Medicare. If you're not receiving Social Security currently, you're going to need to take action, and we're going to show you how to get onto the system. If you do not receive Social Security income when you turn 65, well, you're going to need to sign up for Medicare. And you can do that in one of the 3 ways listed on the screen here. You can apply online at ssa.gov. That's a Social Security website. You can also call into Social Security. The number is 1-800-772-1213. And if you're calling into Social Security, really for any reason, you want to make sure if you live on the West Coast, call towards the end of the day. Here's a little tip. You're going to eliminate most of the East Coast callers by calling later in the afternoon. And lastly here, you can apply at your local Social Security office. And if you go in person to the Social Security office, see if you can call ahead of time and schedule an appointment. All right, now we're going to cover the helicopter's point of view of Medicare. This is where we really take a complex system and put it in a layman's terms. All right, so first things first, I want to focus on the top half of your screen that you're seeing here. This is Original Medicare. It consists of Parts A and Part B. Part A of Medicare, that's your hospital coverage, covers your stay in the hospital. Then you have Part B of Medicare, which is your medical insurance. Part B of Medicare generally covers 80% of your medical expenses. Part B of Medicare does have a monthly premium, and it's based on your adjusted gross income, which we have a chart here in just a few pages. We're going to go over the Part B premium for 2024. So everyone watching this will walk away knowing exactly what your premium in 2024 is. All right, now that we covered Original Medicare, on the bottom half of the screen, you can see what is offered by private insurance companies. So we're going to quickly cover your plan options for 2024. Now, to keep this as simple as possible, I want you to imagine a fork in the road. You have 2 major options, left or right. So now let's cover the first option. Option number 1 would be having Original Medicare, Parts A and Part B. That covers 80% of your medical expenses. Well, there's 20% left over. So now if you go with this option on the left, you would have a Medicare Supplement insurance plan and a standalone prescription drug plan. Now, a Medicare Supplement plan generally covers the 20% that Original Medicare doesn't cover. So you have full co-insurance coverage, and it gives you freedom to see any Medicare-appointed doctor in the United States with no referral. Now, Medicare Supplement insurance does not cover your prescription drugs. It just covers your medical. So with that, you would get a standalone prescription drug plan, and that insurance plan is just designed to cover your medications. You would take that insurance card into the pharmacy to get your medications filled. All right, so now we're going to cover the second option, which is Part C of Medicare, so your Medicare Advantage plans. I'm going to keep this as simple as possible, so I'm going to explain this combination. So Part C will be a combination of Part A, which is your hospital insurance, plus Part B, which is your medical insurance, and in most cases, Part D, which is your prescription drug coverage, all bundled into one plan. These are very popular plans here in the United States. Now with these plans, you're going to have a managed care network. And in most cases, you're gonna have a primary care physician assigned to your insurance, and if you need to see a specialist, then you'll need a referral from your primary care physician. So you wanna look for areas of coverage in the Medicare Advantage plans that original Medicare may not cover, but the Part C plans may cover.